Oh, awesome.
Oh, welcome to episode 2 of the Dear Momma podcast. I'm your host, Dr. Catherine Murphy, and it is my absolute pleasure to welcome Dr. Tammy Gierke Button to our podcast.
Oh, thank you.
Oh, my pleasure. I'm looking forward to our chat today, and I'd like to get started, as it's going to be a tradition on this podcast, to start with a quotation. And today's quotation is "Longevity starts in childhood." These are the words of Sharon Moore, and she is wonderful. If you are looking for a book on sleep, she wrote Sleep Wrecked Kids. She is a speech language pathologist, author, and airway activist. And her quotation is the epitome of why I have Dr. Button on the show with us, because she understands that in the realm of dentistry, if we really want to be preventative, it starts before we have any teeth. So Dr. Button has a very unique practice of pediatric dentistry that has taken her actually outside of the dental office and into the world of family health and wellness. After about 15 years of clinical practice, she now serves as the executive director of Dunebrook. Dunebrook is a community advocacy organization whose mission is that every child be safe, healthy, and happy. And this mission through this organization has been going strong for about 30 years. She also serves as the volunteer executive director of Southshore Skipping Stones, a nonprofit organization that Dr. Button actually created to prepare families to raise cavity-free kids through pregnancy and infant oral health education. Dr. Button likes to point out that it's very ironic, her nature of her dental practice is that she doesn't really look at teeth anymore. In fact, if they have teeth, she usually says, okay, go to another pediatric dentist. But it's more than ever focused on their health and how their health is connected to their overall health, and just viewing it as truly preventative rather than interceptive dentistry. So welcome, Dr. Button. And I have to say your intro, so I'm going to add a little bit more because she's got quite the variety that she was very modest to put in there. And we're going to talk about it through the podcast, but just know that she has had many different interactions as a pediatric dentist, from clinical to having her own practice to then working all the way in Maine to then all the way to Amish country. So her background is very vast. And so with that, I guess I will just ask you to briefly describe that path that took you to starting a nonprofit, and the fact that a nonprofit is not just something you just wake up and say, I'm just going to start a nonprofit. So fill us in, because I do have a little bit of the honor of knowing a little bit that went into it. But just remind us that is quite the endeavor.
Oh, well, Dr. Murphy, thank you so much. And thank you for this podcast, and thank you for the opportunity to talk with you. It's always fantastic to be able to chat with you. And just talking about the journey to getting to this place sometimes it's just eye-opening to just talk through it, because talking to somebody like yourself who also has had a journey of probably not being where you thought you would when we graduated dental school together, which we did together. Yes. It's both exciting and also can be a little bit scary sometimes, to be honest. But my path, I went to Indiana University School of Dentistry with Dr. Murphy, and then did a pediatric dental residency at Riley Hospital for Children, and then got to practice in Maine for a couple of years at a federally qualified health center. When I practiced in Maine, which was just a couple of years ago, there were only 8 pediatric dentists in the whole state. So people would travel 4 or 5 hours to come see me. Yeah. Wow. And so, when you're a resident, when you're in school, you're told a lot of times that you're only going to see these cases when you're in school. And once you get out, it's just going to be, maybe a cavity here, maybe a cavity there kind of thing. Well, I'll tell you, that was not my experience. And I got to develop a pediatric dental practice at this location in Maine because they had not had a pediatric dentist before. And then the things that I saw there, and just with learning how to start a practice and how to meet the needs of scheduling and all of these things. And working with pediatricians, trying to collaborate was my first eye opener of, the 3 minutes I could have with a patient in the chair is so important. And I have to make that worthwhile, because I may not see them again ever or for another 6 months. That's just the nature of that. So as I began to practice more and more, and yeah, like you said, I've had the opportunity to be in some really unique locations and meet a lot of great people from all over the world. And just knowing that a lot of times as parents, the worst thing you can hear is, okay, you thought you were doing it right, but now we've got to do something different. And many times, with trying to figure out what was causing the dental caries, the early childhood caries, and listening to parents say, this is what we're doing, honestly. And we went through and got teeth fixed, and now we're continuing to do these things, and we're still seeing the problems. And, you start to realize there's just more to the puzzle, and you get to start putting this together for yourself based off of your experience. And again, going back to the fact that you're told in residency and dental school that these aren't going to be things you're going to see isn't always the case. And luckily for me, it wasn't, because, I continued to work with a lot of families that had severe early childhood caries. Unfortunately, I did have to remove all 20 baby teeth on many, many, children, at the age of 2. So that meant that they would go without teeth until their first permanent teeth came in, around 6, possibly. That has an effect on you as a practitioner and helps you to realize that for you to be successful, you need to find that information and the niche for you to be able to reach your patients. So,
and what did the mom say? Like, at one point, because this was before you were a mom.
Yeah, that's a good point.
Yeah. So looking back, so when you do look back now as a mom practicing, and knowing this, how do you look back? And I mean, I agree. I couldn't imagine as a practitioner having to tell anyone that all the teeth have to be taken out, and not really being able to give a prosthetic because there are only 2. And so I would love to know a little bit more from, like, now your point of view as a mom looking back, and is this kind of why you formed this?
It's interesting because as a mom now, I wish I could go back and give each parent that I interacted with before I was a parent a big hug and just say what I had to say with so much more compassion and not just a practitioner. And I want to be clear. I'm not saying that you only can have compassion once you become a parent. But for me personally, it gave me that other dimension to realize that you just don't know all the time what you're supposed to do.
Yeah.
And when you go to practitioners like myself that maybe didn't give you that support, or maybe came from this at the perspective of only this is what has to happen, and not really delving deep with the parent into the why, that's not always the best thing for moving forward. So in each of those cases where all the teeth had to come out, there really were different reasons. And to be able to realize that it's not always neglect. It's not always, just because the kid just was able to eat whatever they wanted, or what. There's a lot of reasons that go into that. And I think go ahead.
I wanted to share at this point, which I didn't think I'd be bringing this up here, but I wanted to share with everyone that Tammy's actually the one that I called when my second child, my daughter, I was able to breastfeed her for 8 months, but at 8 months is when we needed some supplement. And I looked on the formula, and it was the same formula I fed my son. It was the one that was recommended. And I have to say, I was so embarrassed. I'm like, okay, well, I've got to find the answers. So Tammy will know the answers. I'm just going to call her, but she's going to be like, what? Of course you're a dentist. Also, come on.
Oh.
But she was the person I reached out to when I saw that corn syrup was the number 1 ingredient and sugar was 4th, I believe. And I was so thankful that I didn't jump down the rabbit hole. I just reached out to Tammy first. And she said, yes, you would have to work really hard to find one that doesn't. And I said, how were we not taught this in school? I feel so out of place as a dentist that I didn't know. So when you're talking about other reasons, and I just have to say, wow, like I get it. Like when I saw that on the label, and that was when I really got it. Like, wow, there's so much out there that we just don't know.
Yeah, exactly. And becoming a mom made me realize that even more. So at the time that I decided that for me personally to be able to practice, I wanted to find a different venue than starting to see kids at age 1. And sometimes even selling parents on the fact that I want to see your kid at age 1, you don't always get that buy-in. And so that made me realize even more that I want to really make people aware of why that's important and why even age 1 could be too late, in my
Mhm.
opinion. So when I wanted to figure out how to do this, I had talked to some people that were also had a similar message in different areas as far as pediatrics or different things, and thinking about how I wanted to do this. And luckily, some people crossed my path that were helpful as far as, have you thought about this? Have you thought about that? Have you thought about, what about a nonprofit where you can reach whoever you want, and if you keep certain, you know, I wanted to find a way that I didn't have to worry about insurance covering something or not covering something, and making that the basis for if it's important or not.
Mhm.
So that's why I decided to go the nonprofit route and be able to provide that evidence-based information that way to whoever needed it, and also had the opportunity to be able to work with people who spoke fluent Spanish who could help with getting that message in Spanish. I'd love to have it in more languages as
Mhm.
well.
So
But
anyone out there wanting to translate, let us
yes,
know.
absolutely, definitely. Um, and working to have the opportunity to talk to a pregnant woman about the importance of her health, the connection of
Mhm.
oral health to her health, the connection to oral health to her pregnancy, and then ultimately to
Mhm.
her baby's oral health. When you say that enough times, you just think, why isn't this just the way it is? And so that really has fueled me to continue to do that. And as you said, you've been very involved in this, actually, which you failed to mention you're a board member. And so obviously very involved in this too, which I fully appreciate. And just being
Well, you
able,
are actually the reason why Dear Mama like kind of got started. You're the nonprofit that asked me to speak about my struggle of breastfeeding to expectant moms, and I said, "Well, okay, yeah, but why?" And when you said, "Well, if it can happen to a doctor, it can happen to anyone."
Mhm.
And that hit so hard that yes, so often we have things in our head, our own limiting beliefs, no matter what, right? And we think it's only happening to us. And it wasn't until I realized how many other people were having similar struggles to just their own health or their kids' health that Dear Mama came. So I remember that. Was it your very first event that you did, like live event that I spoke at?
It was. Yes. Yep.
And Patrick got to be there and hear it. And I'm like forever thankful that, we got to do that. And I remember that group, and I remember walking in there, and yeah, it was incredible. So thank
Yeah.
you for that. So yes, we have a little bit of a
Aw,
history.
we do. Yes.
Dental school, we lived across the hall from each other the first year. And so I always got to know a little bit about where she was going with her career, but when she told me about the nonprofit, I was like, "Oh, you can like what?" So that's why I'm just really wanting to spend a lot of time on this because uh, oftentimes we kind of think a nonprofit, oh, is just, you can pop it from your dream to reality. And instead you went from really, you've cultivated quite the board of having a lot of input and support, and it's very impressive. And I love the videos, and you're right, anybody can go on there. Offices can use your videos,
Mhm.
healthcare centers can use your videos, and they actually explain dental caries in a very easy to understand way. So thank you.
Well, thank you. Because that's, if we're talking about how to prevent something, if we don't talk about what actually it is we're preventing, that tooth decay is a symptom of a disease, and we don't take the time to explain what that disease is, how can we really expect anybody to fully be able to prevent or improve what they have
Mhm.
if they don't have the full story? So, and again, I think that comes also from my mom background too now with I do want to know more.
Mhm.
And so if I do, others do as well. And I want to give them the respect of, yeah, they probably do want a little bit more than the 2 minutes that I would spend and just give suggestions that probably weren't that helpful. So
Oh, well, I still remember telling people, telling mom, I thought it was the perfect answer. I gave the perfect dental school answer for when she asked about grinding teeth. Oh, don't worry, it's transitional dentition. They have an immature swallow. They're going, and I'm like, well, that, yeah, that really, that helped them. Not at all.
right. Yes. Yep.
But
And so
speaking of
you
helping them, you mentioned year one visit. Can you tell us a little bit more about why year one or earlier, like even first sign of like eating, would that be best? You discussed pregnancy, discussing at that point. Tell us a little bit about what moms should start asking for, or caregivers in general.
so in the perfect world, I would say that during pregnancy, part of their OB exams, and then if they are seeing a dentist on a regular basis, there would be that pregnancy visit. But let's just say maybe they haven't for a while, and then also during pregnancy, you would wonder if it was safe. So
Hmm.
then the OB provider or family physician, whoever's managing their pregnancy, would be able to give them some information on the importance of their oral health during pregnancy, the importance of their oral health to their health, and then, have some information about if you haven't been to the dentist for in a while, it's okay. Here, this is why it's okay, why it's recommended, all of those things, and get that started during pregnancy. If a woman comes in for a dental exam before she got pregnant to say, I'm thinking of getting pregnant, oh, that'd be great. That'd be fantastic. Um, but if it is during pregnancy, then just making sure that the mom knows that it's safe to do these things and the reasons why. Again, why it's
Hmm.
important, but also because pregnancy, a lot of people think that pregnancy weakens teeth, that calcium is taken from teeth during pregnancy. But if you understand dental caries and you understand the changes that happen during pregnancy, hormonal changes, dietary changes, morning sickness, vomiting, the acids in your mouth, you understand that, yes, pregnancy puts you at risk,
Hmm.
definitely. So let's understand this so that you can do something about managing that yourself. The other piece that you helped me learn is that dry mouth. So dry mouth during pregnancy, it can be just a pregnancy symptom. It can be because of hormones. It can also be though because of pregnancy sleep apnea if you have a dry mouth in the morning. What a
Hmm.
great thing to be able to let a pregnant woman know that if you're having dry mouth, these are some reasons why. If one of these ring true with you, talk to your OB provider, talk to your dentist. Just again, more information up front.
Hmm.
Other part of this then is from the time the baby's born, it's really important to start wiping their mouth out. And that is because unhealthy bacteria don't have a chance to settle into that oral flora as quickly then as healthy ones. The ones that are healthy in a healthy baby have more of a hold in there. So the wiping out isn't going to just wipe everything out, but you're going
Okay.
to take some of that transitional stuff out of there. So if a baby is having formula with sugars, if there's, other things there, then the bacteria that cause early childhood caries, they can live in the mouth before teeth come in. So that's the other thing, the teeth, once the teeth are in, we're going to see what the oral health is like. Within a couple months, you can start to see that those chalky white spots. You can see that demineralization. You can see that early childhood caries has started. So if we wait till age 1, you have skipped over pregnancy. You've skipped over wiping the baby's mouth out. You've skipped over first foods. You've skipped over introducing an open cup at 6 months. You've skipped over no juice first year. You've skipped over the fact that babies shouldn't have any added sugars until 24 months. You've skipped all of that. So that's why, from my perspective, age 1 is almost too late. You've skipped over how to brush teeth. You skipped over the fact that even if there's one tooth that should be brushed, and the why, flossing when 2 teeth touch, all of these things that, I have a lot of education, but I didn't learn most of this in dental school. It was, after dental school and through practice and things. So to assume that others know this is not really the best way to go. So
you touched on so many different topics. So everything from open cup to no juice to no added sugar to first foods. Which topic would you like to talk a little bit more about? And if, let's say, did any of those topics that I mentioned help you realize that you were seeing patients with tethered oral tissues? Because you were having those released years before I was introduced to having those released. So what did any of those help you with that diagnosis?
That's a great question. So most of the patients that, to begin with, that I was seeing that tethered oral tissue with were in the age range of 3 to 6.
Oh, okay.
So in the beginning, just coming in, and parents would have different. So these are kids that, either breastfeeding was difficult, but they found a way, or there was pumping involved, or breastfeeding didn't last very long, or whatever it might be. And so they got through that. But now they're seeing different issues with eating, or textures of food, or the dry mouth and always licking lips, or, just all of these random things that at first pass, like, oh, well, it'll be okay, right? So I had the good fortune of a colleague of ours who was another dental school classmate, who was a periodontist.
Class of 2005.
That's right. Representing here today, that's for sure. She had done some additional training and was performing laser releases. And so she would actually come to my practice in Bloomington and do this and manage the exercises and all of these things. And so she would have a consultation with the patients. I would, when I would see them and be able to identify this, then she would further see them and do evaluations and things, and then move forward with that. So that was the initial things that were happening. And I have to say, then, this is another place where being a mom helped with realizing, for me, then, was starting to see infants, and some as young as newborns that were coming in for evaluations, that in the world of a new mom, a week or 2 days is forever. When it comes to trying to feed your baby, the next feeding is just a couple hours away. And so that's really, I think I became more aware of that, obviously, being a parent, that, time is very different when you're a new parent and you're worried about what's going on with that. So,
what a powerful reminder. Yes. Because how quickly we can kind of forget, because it's only been about 2 years for me, but yes, it brings me back to those days of, oh yeah, she's going to be eating again soon.
Yes. And I still don't have any answers. Right. Yeah. So that sped up my, let's just say, uh, reason to address these things more than just a wait and see. And
Mhm.
when I say that, I don't mean that I would recommend things just because we're going to recommend them, but to get the ball rolling. For
Mhm.
there's nothing wrong with bringing other people in to help to evaluate this and to see what can be done or what the issues are, whether it was a lactation consultant or talking to the pediatrician about other things that might be going on, so that we could get some resolution quick for whatever was going on.
Excellent. Yes, I'm very thankful that you took care of your patients in that way. So thank you on behalf of all those moms that you helped out in Bloomington. So actually, I would like to ask you some questions I like to ask all of my guests. What aspect of motherhood surprised you the most?
Oh, how I think so. I'm a pediatric dentist. I've worked with thousands of kids. Aspect of motherhood that surprised me the most was still feeling completely unprepared.
Has they
Yes.
gotten better?
No. I'm more comfortable with it and okay with it, because it's always something new. It's, as soon as you get a handle on something, it changes. So, but yeah, but I'm okay with it now.
Well, good. I think that's part of part of motherhood to accept that there's very little that we can actually plan, right?
Yes. Yes.
So having people that you can have, they have support of you is key. And what mom to mom wisdom would you like to share?
I think along with that, that it's okay to admit that you feel unprepared. You don't have to have all the answers. And I think the quicker you can embrace that, the better off you are and your child, because it's okay to call or or email or whatever it is with your pediatrician or the people that you count on. It's okay to do it quicker than thinking about it or thinking. I know for me personally, again, I'm a doctor. I ought to know every side effect of an antibiotic, or I ought to know every symptom of this or that. And I would wait to reach out because of my own pride.
Hmm.
What was that? I mean, so um, the quicker you just realize that your child, you are your child's advocate. So just do that. Advocate for your child. And if you think that you should know something, it's okay. You'll learn it. So
And none of us can know everything,
no. Mm-mm.
no matter how hard we try. There's so much knowledge out there. I like the quotation. I don't know who said it, but we're swimming in information, but what we really seek is knowledge. But
Yes.
there's a lot out there, and we're not expected to know it all.
No. No. Nope.
But with that, with you speaking about being your child's advocate, as you know, I am a big advocate of if you can't take care of yourself, you can't take care of others around you. So the Take Three for me was started, co-created with Bree Grisich, and it's our 3 minutes of self-care that's sustainable self-care that everyone can carve out 3 minutes to do. And so would you be willing to do some of the
Oh,
Take Three for me with me today?
sure.
Okay. So first, for those that aren't driving, put your hands up if you can, wiggle yourself out, I also like one of my favorites is the fluffy head where you can just kind of put your fingers in your
Mm.
hair. Oh, and I like to put my thumbs right there on the base of my neck and give a little bit of massage. If you're driving, when you get home, you can look at some of my Facebook ones. You could do ones with the tongue. I like the tongue push-ups where you go like this. You put your tongue up to the roof of your mouth. So just something that gets you connected because you've been sitting down most likely a lot today. And then the next section is the mindfulness, kindfulness, where we look at what we are proud of ourselves for, our intention for the day, and what we're grateful for. So, Dr. Button, would you like to share any of those with us, all of those with us? What would you like to share with us today?
Well, if you can remind me. So the first one is what you're proud of.
Hmm.
Okay. I am proud that I'm here today speaking.
Excellent. Yes, and you gave up your time and you did something that's not really, it's a little bit out of your norm. So thank you for
Hmm.
doing that. And what you're grateful for?
I am grateful for um, the ability to be able to recognize when I don't know something.
Oh, yeah, that should also be something that you're proud of.
Yeah,
Proud
yeah.
of and grateful for that. That is what gets you on the cutting edge, which is where you are, because being an inspired provider to know when others need to come in and being, the mom that can find the answers for those unexpected questions. So that's excellent. And what's your intention
Thanks.
for today?
My intention is to be able to look outward and see all the beauty around me because there's just so much. Like the sun came up this morning and spring is happening with a little winter, but there's so much that goes on for us every day that we don't have to orchestrate. It just happens for us.
Yeah.
So to really focus on that, to remember that there's a lot that is just amazing every day.
So that's perfect to actually lead into the third, which is just to focus on your breath. Since this is a podcast, we won't do the full 3 breaths, but just as a reminder that with each breath, we're nourishing ourselves. So I like to think of breathing in energy and exhaling stress, or inhaling love, exhaling judgment, inhaling calm, exhaling chaos, and really thinking that we can calm ourselves. We can take care of so much when we regulate our breath. So thank you, because that's also a time that we can, breathe in the beauty and abundance and breathe out the scarcity mindset. So thank you, Dr. Button.
Hmm. Oh, thank you.
Depending on when you have found this podcast, if you are interested in hearing more from Dr. Button, she will be working with Airway Circle for a course on Saturday, April 9th. And so please check that out. If you are a member, they will also have it recorded as well. But if you are not yet a member, now might be a good time to sign up and listen to her course about the first 1,000 days. So that takes us from pregnancy to the second year of life for children. And we'll go in more depth about, reading labels, having no sugar before they're 2, the many things that should really be discussed before a mom is in the trenches of being a mom.
Yes.
But oftentimes it's not until those Google searches late at night or my own realization, like, oh my gosh, I just bought this. Can I return this stuff that's got corn syrup number 1? So please look into that, because the first 1,000 days really, as Sharon Moore said, longevity starts in childhood, and that childhood does start in utero with those first 1,000 days. So thank you so much, Tammy. I'm just excited that more people get to know about Southshore Skipping Stones, which is southshoreskippingstones.org, and check that out. If you are in an office that sees kids, please feel free to share those videos as well in the office. Share them on whatever media that you need to for moms to get those messages out. Because I will let you know, dental school, we don't spend that much time actually focusing on how to describe the process of a cavity. So this is really enlightening for any parents who are like, what? It's just a cavity. We just need to take the word just out of just about everything.
Yeah. Yes.
And your goal to truly empower others to transform the thought from interceptive dentistry to truly preventative dentistry is a very, I don't even know quite, I can't think of just one word to embody that goal. So I will just say thank you for that being your goal.
Oh, well, thank you. This has been a
And
pleasure talking with you today.
we should do this again.
Yes, let's do it.
And my next guest for episode 3 will be Lael Johnson with the Facial Connection Myofunctional Therapy. She is a New York-based orofacial myofunctional therapist offering global virtually and local in-person therapy. So Stay tuned, follow Airway Circle Radio so that you can hear the next one. And I really just appreciate you taking the time, Dr. Button, and for those listening for taking the time to listen, and reach out if you have any questions.
Oh, thank you so much.
Oh, and we get to listen to my daughter's laugh one more time for those that want to stick around.
Oh,
because that's really why we do this, isn't it?
It is. You're right.
Oh, take care. Thank you so much.
Thank you.